Somebody was asking, is a cannula preferable for the tear trough to a needle?
No, it's just a tool. It's the doctor's comfort. Some doctors swear by the cannula, some doctors swear by the needle. So it's the doctor's comfort. That's just a tool that the doctor uses. So it doesn't make any difference to your result.
Thank you. And if you're a doctor who's sort of learning, I guess it's you have to use the cannula and use the needle enough to determine where your preference lies.
I wouldn't say necessarily. I think as long as, if you are a practicing doctor, you should know your anatomy before you really touch the patient's face. So I would say you'd know your anatomy. So once you know that, then it doesn't matter whether you use a needle or a cannula. You need to know how to stay safe, which is the plane that you need to enter, what's the size of the cannula or the needle, what should be your bolus size each time you're injecting. So all of this will really determine on, like I said, what is needed, need of the hour, and the doctor's practice.
Thank you. Lovely. Somebody's asking, could we explain Hyalase, or could you explain Hyalase, please?
Hyalase is a chemical which breaks down the filler, which breaks down the ground substance, like a hyaluronic acid. So it breaks that down. It might even have some effect on the fat. I am not too sure. I think it does. So it does break that down too. So that's just an injection that your doctor will be able to do it for you. And if you're a doctor asking me that question, then you know what's Hyalase, and I end up injecting it right into the belly of the festoon, deep in, and maybe I would be using like a 10 units, not more than that, or a 20 units, and then just let it kind of ease off and see how much it dissolves. And maybe I could call my patient again for a second round of Hyalasing and then attempt the filler around the festoon.
Okay, thank you.
Yes, hyaluronidase.
Yes, full name, and prescription only in the UK. I'm sure it is with you.
Yes,
too.
Same here, same here.
After fillers, how much of a gap before energy devices?
I usually like to do my energy devices first and then go for the fillers. We could do it on the same sitting if you want to. But then if you do an energy-based device and a filler immediately after, you could have a little more bleeding and therefore a little more bruise. So it's best to do it at different sittings. And if you have to do an energy-based device after a filler, then I would give it a gap of at least 10 days or even more for that matter.
Thank you. And there was the issue of lymphatic drainage and how that affects the tear trough.
Big time, big time. So it's extremely important to have a good lymphatic drainage system. Very important, especially these days that we are all doing too many tear trough injections, cheek injections, needle poking, cannula yanking it out, destroys the lymphatic system in that area and causes even more water retention. So it's extremely important for us to have a good lymphatic system, but however, we don't know how to repair a lymphatic system. So once destroyed, then you just have to assist the drainage of fluid from that area manually with massagers or with kind of those jade rollers, and just to kind of drain the fluid away from that area. That's the best that you can do.
Okay, thank you. There's a few questions about darker lips, and there's one for, do lip fillers help reducing pigmentation on lips? No, how could they do that?
Yeah. No, maybe just that expansion of the surface of the lip when you do the filler might make it look a little more lighter and a little more maybe pinker. But then no, technically it actually doesn't.
Okay, thank you. And somebody else asking about what she can do for dark lips.
Any skin lightening cream on the lip will really do well. Whatever you use on the face, just be liberal on the lips as well. Lovely. Stop smacking your lip and kind of treat it as well as you treat the face.
Yeah, because we often don't mind putting treatment products on it, not at least because we're always eating and drinking and taking them off again. But yeah, a bit more. It's like with the eyelashes. You know, we never think that we're washing and scrubbing and drying them, and generally not conditioning them and treating them in a really quite aggressive way on a daily basis. Then we wonder why they won't grow. But before we finish, could I ask you a few questions about sort of treating the face as an individual and helping people look their fabulous self? Because I know you're really good at helping patients discover their natural beauty, sort of their beauty, rather than trying to fit some
put them in
template.
a template. Yeah.
You're known as the beauty doctor of Bollywood, and you work on a lot of amazingly famous faces. But the great trick is to make somebody fabulous without turning them into a clone of somebody else or a standardized version. So how do you go about that whole process?
To me, like when I see a patient, I always see what's the first thing that attracts me about them. It could be the smile, it could be the eye, it could be a brow. I think, whoa, something is attractive. Then either I try and make that even more attractive. For example, if you have beautiful large blue eyes and then you have a tear trough, I would rather end up working on the tear trough to make sure the eyes are more beautiful and enhanced. Or if I think that everything around your lower face is very beautiful, maybe I'll enhance the lip a little bit to give it that. So I would work on your individual most beautiful thing, and then I would work on that individual most troubling thing on the face. So those are the two ways I look at it and work. And then, of course, it's an individual that you just enhance to make them look their youthful best as well, and then their attractive best. So that's the way I go about.
That fantastic, and that makes absolute sense, because too often in this country at the moment, certainly among the younger patients, they all want the same thing. They all want a bit of drama, and they want bigger lips.
Chin and bigger lips, yeah.
Then you add a pop of a cheek, a big lip, and then they get eyebrows, and they all look the same.
Same, I know.
And you think, kids, you know, you've got all these wonderful characteristics, and surely. But it's not restricted to them. I remember sitting in a coffee shop in the center of town. There were a group of mothers. They looked like they'd just done the school drop-off. This was years ago. But I was looking at them thinking, it's really strange. They all look as if they're slightly related. And then I started, I did start to wonder if they all went to the same doctor, because they were all a bit done. You know, the eyebrows were a bit up, and the cheeks were a bit angular.
Yeah.
And it shouldn't be possible to see that in a group.
Yeah. The minute you can identify that work is done, I think the magic is lost.
Okay. Yeah. That is a very good point. Right. We've heard it from the top. So have you got the strength to answer a few skincare questions before we finish?
Sure. Why not? Let's just take them quick.
Somebody was asking about the best regime for, there's several questions about the best regime for acne and pimples, managing acne. What's your favorite strategy?
So favorite strategy is go to your doctor, because it may not be as simple as it looks. You definitely could have a hormonal imbalance, which has to be treated no matter what you put into work for you. 2, if it is a very acne, which is on a very, very oily skin, your go-to ingredient over the counter could be benzoyl peroxide, could be salicylic acid. But if you end up having acne on a very dry skin, then you may want to hydrate the skin to actually help it heal on its own. So you could look for ingredients like hyaluronic acid, niacinamide, ceramide, all of these. So that's the way you would end up working. But for an antibiotic, if there is the pustular acne, please don't self-do that. You have to go to your doctor, because once your acne gets resistant, then it becomes impossible to treat. And the other no-no is, of course, don't pinch your acne, because if you thought acne came from a pocket, which was your oil gland, you're highly mistaken, because it's not a single pocket. It's got multiple pockets, like a bunch of grapes. So if you end up squeezing them, they will escape to the other pockets, and you end up infecting the whole bunch. So don't do that.
No one. I saw on Instagram this morning, somebody had sent a picture of their dermatologist saying, I'm 39 years old and I squeezed a tiny blackhead 3 days ago, and now it's become,
it's huge.
And the dermatologist had posted just saying, live and learn. We all live and learn. But I thought that's a very familiar scenario. So now we know why those grape-like pockets, that's an awful thought. That will stop me, because I still have oily skin, and I still find it very hard to leave it alone. Now, last question, perioral darkness. Where do you begin to treat perioral darkness? Would you go for a standard cream like with prescription hydroquinone?
So for me, perioral darkness is either familial, because everybody in your family has it, you have it too, Or two, the skin is super dry. So I would start with just hydrating your skin. That's the number one thing. Stop any friction, scrubbing, rubbing on the skin there. Once you really hydrate well, then I would look at a skin lightening cream as an add-on only at night with a good sunscreen in the morning. You could even go to your doctors to do a little bit of hydrating injections in that area, which helps heal and repair the skin really, really well. So for me, hydration is number one, skin lightening is number two.
Fantastic. Rashmi, thank you so much.